Cheap, accessible and calorific. Burger and chips, every few yards in this township outside Cape Town there's fast food. Think South Africa, sadly, think HIV. But somewhere in the past decade that has changed. Obesity-related illnesses are the #1 cause of death, HIV the 4th. 50% of adults are overweight or obese.
We haven't seen this coming, and it's not been one issue. It's been the built environment, ultra-processed food that constitute 40% of the average South African's diet. KFC index, as I call it. There's a KFC for every 60,000 South Africans.
Dr. Nomathemba Chandawana is an expert in HIV, but in recent years has been exploring the intersection with obesity.
Almost 60% of women living with overweight and obesity. This is set to double in the next decade. So we need to throw everything that we have now for us to prevent a disaster. You know, if we're comparing HIV, 8 million people living with HIV, we have about 25 million people living with overweight and obesity.
An official survey recently published described the triple burden of undernutrition, hidden hunger and overweight or obesity due to inadequate diets. There is even research into the link between HIV drugs and obesity, although the US government's cut in international aid funding means a large study has just been cancelled. South Africa is not alone in its rising obesity rates, yet in the global north, in the richer countries like the UK and the USA, they have these new weight loss drugs that everybody's talking about, Wegovy and Ozempic. Here, they are simply too expensive. They are not available in the public health system where you could argue they're most desperately needed. In South Africa's townships and its cities, it is an ever-growing problem. But these new weight loss drugs cost the equivalent of £130 a month, beyond the pockets of most.
This is Victoria.
Good afternoon. A support group for women with type 2 diabetes. If the new drugs had been available in the public system, many in the room would have been eligible. It is specifically licensed in South Africa for type 2.
We won't be able to afford those kind of drugs.
No pension.
I work 6 days a week, 14 to 16 hours a day. So there's no time for me to prepare a meal. So you eat on the go. And that's why I turned out to be diabetic, because of eating junk food almost every day.
We can't afford a gym. You can't go run outside, you'll get robbed. Or you get raped.
This is exercise in the middle of a township. Monthly membership is the cost of the price of a loaf of bread.
Boom, throw it up, bring it on your side, throw it up.
It's part of a health park research site run by the Desmond Tutu Foundation, with a sexual and reproductive clinic next door. The hope is that they will come to the clinic if they need it and then go to the gym.
This is a model we're hoping that our government and other governments can take to say, this is an integrated way of having a sustainable, healthier population, especially in adolescence, where it's a time that we can change behavior.
The South African government has put in place various interventions, including school nutrition programs. But experts say it is an own goal not to go further. For the lack of good food and a place to play, they say the health of the young is now at risk.